Today we're taking a look at Skinfold body composition assessments, and we're joined by Arthur again, who's going to happily be our volunteer. Now, before we get started, we need to get Arthur to remove any kind of bulky clothing, and it's also important that you ask for consent to make sure that they're okay with the level of undressing and the fact that there will be some light touching involved. Let's quickly run through the equipment that you're going to need. You're going to need some Skinfold calipers, an anthropometric tape measure, a Skinfold pen, a data collection sheet and a regular pen, and finally a calculator so you can do your calculations. For our Skinfolds, we need to ask our participant to stand in the anatomical position. So Arthur, if we just ask you to stand in that anatomical position. Perfect. Palpate laterally along the spine of the scapula to locate the acromion process and mark with your skin pen. Next, locate the proximal radial epicondyle and mark with your skin pen. Using an anthropometric tape measure, measure between the acromion process and the radial epicondyle down the lateral surface of the arm and mark the midpoint with your skin pen. Wrap the tape measure around the arm at the identified midpoint. Use the tape measure to draw a horizontal line across the belly of the bicep on the anterior surface of the arm and across the triceps on the posterior surface of the arm. Remove the tape measure and draw a vertical line through both of your horizontal lines in line with the midline of the muscle bellies. Ask your participant to place their right arm behind their back. Next, locate the inferior angle of the scapula and ask your participant to return their arm to their side. Once the scapula has returned to normal, mark the inferior angle with your skin pen. Measure 2 centimeters down from the inferior angle and make a dot. Next, measure 2 centimeters laterally and make a dot. Turn the last dot into a cross as this is your Skinfold location. Palpate up your participant's hip to find the iliac crest and mark with your skin pen. Place your index finger on the mark you have made and using your thumb make a horizontal pinch above the iliac crest. Draw a horizontal line across the middle of your fold, release your pinch and make a vertical line through the horizontal line. Let's go over the anatomy of the Skinfold calipers. Now, they are designed to be used by right-handed people, and unfortunately, if you try to use it with your left hand, you actually can't read the dial. So you will have to learn how to use them in your right hand. You can see that you should hold it in your grip and use your fingers to open and close the caliper themselves. Looking closely at the dial, you can see that there is an outer dial and an inner dial. And when you are squeezing on the caliper, you can see both of the needles will turn. Now, if the needle on the outer ring goes all the way around, you need to add on the value that's shown on the inner dial to your score. So as you can see, because we've gone all the way around, the outer dial is reading 8 millimeters. The inner dial has gone past the 2 centimeter dial. So this reading would actually be 28 millimeters. The other thing to notice is that the calipers have a very powerful spring mechanism that can cause quite painful pinches to your participant. So when you are finished with any of your Skinfolds, you need to open up the caliper afterwards and take it off and not let it snap back, because as you can hear, that would cause quite a significant amount of pain. Want to make your pinch about 1 centimeter above or below the actual site you've marked. You want to bring your fingers out quite wide, draw in the skin, and then you can ask your participant to lightly tense the muscle. If there is any muscle underneath your pinch, then that will actually pull it away from your fingers. That's all good. You then want to open up the caliper, place it onto the site exactly where you put it. Let go, count to 2, 1, 2, read the dial, open up the caliper, take it off. Just want to take a pinch about 1 centimeter below our site and draw in. And again, you can ask a participant to tense their muscle, try and help pull away anything that might be muscle tissue. You can relax. You can also roll the site in your fingers a little bit. You then want to open up the caliper, place it on the site, count to 2, 1, 2, open up the caliper and release. You want to make a 45-degree angle pinch 1 centimeter laterally to the site. Apply the caliper, count to 2 seconds, read the dial, open up the caliper and release the pinch. Make a horizontal pinch 1 centimeter laterally to the identified site. Apply the caliper, release your grip, count to 2 seconds, read the dial, open up the caliper and release your pinch. First we need to find the average of each of our skin folds and then add them all together to get our sum of the 4 skin folds. We can then plug in all the answers along with some of the reference values to calculate body density. And as you can see, Arthur's body density is 1.075. We then calculate Arthur's body fat percentage using the Siri equation, and plugging in the body density score we got from the previous step, we can see that Arthur's body fat percentage is 10.29%.